So I'm using today as a good piece of reflection as a nurse. I've been in the post now since May, so nearly 12 months in, I'm using this as a good piece of reflection. So prior to this, I used to be a school nurse. I'd been in the school nurse service for 12 years and I was completely comfortable there. During that time, I did the specialist community public health course for school nursing. And whilst doing that, I'd focused on special educational needs and disabilities. And I wrote an essay that perhaps will ring true to a lot of people here, that I asked in the essay, where is the health within the education healthcare plan? And this phrase had been used a lot at the time. And the essay I wrote looked at improving health's contribution to the process, because it was a very educational orientated process. Fortunately for me, a job was advertised to do just this at the start of last year. And because of my history of understanding child development, the education system, and as well as SEND, I had the confidence to apply for this new post. It was a brand new post and it was in development. Reading the job specification, which I haven't been able to add to the slides, but I've added it in an email, so perhaps I can pass that around later. There was a big bit of me that didn't quite think, like, how's this going to work when I'm, when I was in post. So going into the interview, I was quite nervous. And in the interview, it was with the lead of the children's services, the DCO, as well as a service user that asked the questions. So, as I said, my role was advertised brand new. It was quite interesting to hear Zoe Richards talk about an in-place SEND nurse in Lancashire, as I'm not sure that there's actually many out there. I haven't seen many adverts out for a special educational need and disability nurse, apart from one in London that was working with youth justice, children and young people. So it's going to be really good to link out to anybody that is employed in a similar role. So it's a brand new role within Bradford District Care Foundation Trust. Just those that don't know Bradford, it's a community trust that covers the 0 to 19 public health, but we've also got the all age mental health care and adult community care. So in essence, all services may deliver care to those with SEND, enabling, the role was to improve co-working with services across all ages and improving transition. It is a developing role, and the advert was to change the culture of SEND, ensuring that staff understood SEND and the SEND code of practice. And what with the inspection, Bradford just got the call yesterday for their initial inspection, and forthcoming national SEND review. It's going to be interesting how my role develops over the next few months and year. The reason behind the advert was that SEND had always sat within our special school nursing team. And then the trust aspired to make those with SEND everybody's business. So through employing a nurse with a mainstream school nurse background, the intention was that, just like it had done a few years previously with safeguarding, SEND would run a golden thread through the care of those within Bradford and Airedale locality. So on my first day, I met with the line manager and the DCO, who I link in with very, very closely, and I was given the RAG rating action plan. I think it's been shared quite widely on the CDC forum, and this was an action plan that had been devised by I think it was the Northumbria DCO that initially devised it, and it was devised to prepare for the national SEND inspection. So this was my first guide as to what I needed to achieve in the first few months of the role, and that's with the strong intention of ultimately improving the care for those with SEND and the support their families receive. So a big expectation was that I had to share my knowledge of SEND, which it's a very broad subject, and obviously it's growing all the time, and I'm learning every day. But it's my role is to share everything I learn with as many staff members of Bradford District Care Trust as possible. So to do this, I set up a SharePoint, just concentrating on SEND. So I've just put that on the slide here, and that's just gives an example of the front page. It's got some useful clips, and they're quite central in it is the code of practice, so that staff can access that quite easily. This is where all the information sits, and everybody in the trust can access this. And then further down, we do add another clip, which is usually last month it was the fecal alcohol syndrome disorder, and this month it'll be changing to focusing on Down syndrome, because it is World Down Syndrome Day on the 21st of March. So some of the topics are decided because staff will say they need more information on it. They don't know much about that. I think the one before had been Tourette's, as staff were getting a lot of referrals in relation to tics, which had been on the increase. So we try and keep that relevant and pertinent to what staff need to know.
Louise, Joanna, we do have a question from Louise. Is this just for the trust internal, or and does it link to the local offer?
Okay, so what I do is the local offer, they produce a piece every, so they were going to start doing like a focus on a condition every month, and so I was already doing this. So what I do is I share what I write. It's only 2 or 3 paragraphs. It's only but it usually includes a YouTube clip or something, you know. So there's good sharing with the local authority, and that obviously goes into the local offer. And it's usually about charities. So what I usually do is I put in links and charities, so that I'm not so brave as to say I'm knowledgeable about everything. So you know, it's about where do we find help, or what's here locally. So yeah, we do link in with the local offer, and we do share this, but nobody else outside of Bradford District Care Trust can look at this SharePoint. No, they haven't got the access to it. Does that make sense?
Yes, thank you. Sorry, I couldn't get off mute. Thank you. Yes, it does.
Yeah, and then just using the SharePoint again, have subsections, and this is really, it's all about educating staff, getting information out there, you know, disseminating what's new, what's coming up, what's relevant. So the document section in tile, you click on that, and it, you know, that'll be where the green paper will go. That'll be where the research that's come out of COVID goes. And it's just about having, you know, all these documents that are coming out. There's a lot to go through, but it's there if people are wanting anything relevant. And the next one, it's the education healthcare plan tile. In there goes all our good examples, you know, what the education healthcare process looks like, how to support people through annual reviews, how to improve content, etc. The next tile is the voice of the child and FFT. That's again a big piece of work that we're doing, which I'll come to in the next slide. Training is our local training. That's going to be under development because we're going to introduce the Capita portal soon. So that'll be all under training. Transition is all our preparation for adulthood and transition work stream that's going on, and it's all the documents that may be relevant to support staff that in our LD transition team. And then in the news, it's all the upcoming all the newsletters from as far and wide as I can get them. It does take a long time to keep up to date. It is it is a big piece of work keeping this all relevant and new, and taking the old stuff out. So that can take a little bit of time, but but as you know, as perhaps DCOs, you have to sift through a lot of information that gets sent to you, and it's about putting everything that's up and coming and relevant onto there. So that's that. For us at Bradford District Care Trust, we are really committed to getting the voice of the child, young person and family with SEND heard and responded to. This is a big piece of work that's been going. It was really, really important to me, this piece of work, and just the one question that I came to the interview with was that I didn't feel Bradford had very good co-production systems set up, and this is something that, you know, they're still not in place very well, but there are plans to improve this. So at the same time, I was working with another nurse, and she'd been reviewing records during COVID to see if the voice of the child was present within documentation. And together we're working towards writing training to improve communication with children and young people and their families within the trust. So ultimately information, both during assessments as well as the annual reviews, will reflect what the child, young person and family have asked for, and responded, you know, and respond to that. So our future ambition is to incorporate better co-production processes so that, you know, children, young people and their families are heard and shape the services at Bradford District Care Trust. So this is a bit of a poor slide, really. I really struggled to get some information on, but this is just a little snippet of something we've been doing with the SEND champions. So this is a group of staff representing each service predominantly involved with SEND, and we've each written a scenario based around contact where SEND may create a barrier to the care and how this can be overcome, and then what resources are available and where. And the aspiration is that staff, specifically staff who may come across a new situation or be new to the role, will have a short guide to access support specific to their role. So some examples is, you know, we've done immunising a child with autism, or dental care of a young person with a learning disability, and this is on top of the advice also available on SharePoint, but I don't know if you can read it. We've just written sort of an example scenario. It is it's supposed to be a broad structure, not really to identify anybody or any specific person, but it's just about sort of teasing out what's observation and what actually is the voice of the child and how to better document it, should we need to go back to that documentation later. And that's hopefully going to improve how we provide content for the education healthcare plan assessments and reviews. So just moving forward, this again is come from the SharePoint. So each person that is a SEND champion within the trust, we can staff can see who they are, who's in their team that they can be a go-to for support. So our SEND champions, they're fabulous team, and we meet monthly to share information and support, as well as to discuss work streams and feedback any difficulties arising. So there's at least a regular 8 to 10 members of staff who attend, and in that we've got speech and language, we've got the administrators, we've got the clinical lead for systems, because a lot of the time it's about collecting data and pathways, as well as the clinical work that goes on. The children in care nurse comes, and they've all got different viewpoints and different ideas. The immunisation nurses, the dental nurses, and it's a really good monthly meet where we all bounce ideas and problems we're facing and get some solutions. So one of the problems that we were having, that I think probably everybody's going to sort of nod their head and agree with me about, is that we have the extended appeals tribunal cases, and that they started coming through about November for Bradford, and that was brand new for us because we weren't part of the pilot. That created a lot of anxiety amongst staff, and it was my role to support staff. But obviously I've never been involved in the extended appeals tribunal process, so there was lots out there for local authorities, but it was, it was quite hard to fish around for things for health staff in specifically, about being expert witnesses and things like that. So there was a lot of psychological support, a lot of meetings, and then we've been writing a standard operating procedure for the locality in relation to health specifically. Because some of the situations that were arising, we needed more executive support. So a senior executive team called the Send Equality Steering Group has been formed, and that enables frontline information to be escalated so that those that can make changes in this group meet bi-monthly, and we all link in together with the Send champions. And that's been quite important in terms of the extended appeals tribunal process as well, that we've got that higher executive support. So key aspect of the role was that we didn't really have numbers and figures, and we didn't really collect what was going on for Send within the trust, how much work it was creating. None of this was collated before I started in May. So one key aspect was we need to get some numbers of how much work is coming in from Send, how many children have Send, who needs our care and attention, and what that looks like. And so this data collection, it really started about whether we were compliant. And so we did an audit, well, I did an audit regarding compliance, and that's looked at compliance for time frames, but also compliance of consent. And then the next audit that's to be carried out is to be looking at quality and content. My hands are a little bit tied at the moment because I'm waiting on a quality assessment tool for EHCPs, and that's been working with the DCO in relation to this audit tool, and then we can start exploring the content better and looking at annual reviews. But we've got in Bradford over 4,000 education healthcare plans registered, and we've got probably, like everywhere else, quite a big shortage of staff. So there is a big bulk of work here that is going on within the trust, and it's about supporting staff with this as well and recognising how much work goes in. As always, improving the contents of education healthcare plans is really important, and staff continue to need support and education, especially we're going to be introducing the Capita Portal service soon, but that's really good because that's going to give us an opportunity for improving the templates which we're working on. We will invest in the training and the skills of staff to assess, identify and document this within the records. So all this will need to be measured and the outcomes assessed further as well. So lots of work ahead as well. Outside of the trust, I go to weekly meetings with the DCO and a regular monthly meeting with health partners and broader Send partners, such as, the education psychology team and local authority, children's social care, hospital partners. So all these meetings, we look at Send work streams. So there's different meetings, such as the preparation for adulthood meetings. I'm also leading a working group with different Send partners in relation to the voice of the child, and we're co-working some larger scale training in relation to this, working with children's social care. I've attended the open houses events within the locality, ensuring that co-production is taking place on behalf of BDCFT, as well as some of the larger regional meetings as well. As Send is such a broad subject, there is so many meetings to attend and feedback about, and all agendas and minutes need to be disseminated. So again, they go on Send SharePoint, they're uploaded. So if I have gone to a meeting and need to get that across to, I don't know, all the staff in the learning disability transition team, they're there to access it. It's just an easier way to do that. The challenges, though, it's not been an easy ride. Obviously, staffing and recruitment pressures are tricky at the best of times, but within Bradford locality, there's always been a bit of a difficulty recruiting staff. So we've got low numbers of health visitors, low numbers of school nursing. So having small numbers of staff to do large numbers of work, such as the annual reviews, for example, is quite a difficulty, and working out smoother processes with health and SEND partners is part of my role. One challenge has been that a lot of staff have very little awareness of SEND or the SEND code of practice, and actually what it means for the child and young person in our area. We in the trust have a very strong safeguarding thread, but SEND was nowhere near in comparison, and my goal is to make it as equal as the safeguarding thread, to make it equitable. There's many myths around SEND for our clinical staff, especially say for example, the health visitors felt SEND was only related to school nursing, and so they didn't sign up for the training provided. Because nobody kept numbers on training, it wasn't sort of recognised. So now we've started taking numbers on training and collating data on which staff have done that, and making sure that everybody has some regular up-to-date training, ensuring that the training's always there and accessible, so that if staff can't make the training, they can at least access it in their own time, because we have to be considerate of their work pressures. So we don't want to be adding a lot of training in when people are already struggling with the demands of the mandatory training. But one way I've tried to help staff embrace SEND is so that they emotionally connect with it and understand why SEND and inclusivity of SEND is important, was to ask for the Oliver McGowan story to be mandatory training on ESR. It's only a 20-minute clip, YouTube clip, but it's quite an upsetting story, and I feel like afterwards people do emotionally connect and think to themselves, actually, I want to do better in this area. So my hope is that when people have watched that, they will think more of why SEND is important. Another challenge has really been to create a process of obtaining individual feedback. I have been to the open houses events, obtaining more generic feedback, but this work stream is very much in progress and needs a bit of work. So we've got key priorities at Bradford over the next year. Bradford has always been concerned about safeguarding missing children and those not in education. For those that know Bradford, we've Bradford and Airedale locality, we've had a history of child sexual exploitation over the years. So I think as a service we've been quite hot on keeping those numbers and keeping in touch with those children. But more so following the COVID-19 pandemic, we at Bradford feel we must touch base and support those considered hidden children who've not returned to education or have a low school attendance, whether this be through physical or mental health. So another role is going to be funded, and I suppose it looks a bit like the first slide from the Department of Education of a SEND safeguarding team, and this will be a sort of hand-in-hand role, SEND safeguarding, sort of exploring whether these children, these hidden children, have any SEND needs, and what the assessment will look like and how they are met. So that's quite big news, and the advert might even be going out today. So in addition to this, we're also employing a health visitor, and they're going to be funded for a sort of early identification and assessment, right at the earliest point, looking at children from NICU. And these job descriptions, the intention is they'll capture and analyse much needed data before an action plan is created to tackle what we recognise as a need within the system. So there we are. On a final note, whilst I was finishing this off yesterday and then checking it all, we did get the long-awaited call from the send inspection that arrived. So that will probably shape my so I've done 10 months in, and that's going to shape probably the next 10 months, looking at what we need to do, as well as the national send review and how we need to improve things. So that's the end of my slides. So I'll just turn it off and I'll be able to see, and if you want to ask any questions.
Thanks, Joanna. I did have a hand up during your presentation, but then it went down, so
okay.
Or Andrea, you can go ahead.
Oh, hi, Joanna. Thank you so much for presenting.
Thank you.
So I've got two roles. I work as a DCO in Surrey 2 days a week, and I'm now working as the nursing professional manager for SEND for NHSE with Lorraine Mulroney. And so I was listening to you talking through that and could empathise with everything you were saying. But one area that I was really interested in from my DCO role is around all the work you're doing on the local offer, because you seem to be doing an awful lot of work, whereas as DCOs we ask the providers to update the local offer. So is that something that has just evolved because you feel that you are going to be quicker at doing it, or what was the reasoning that you feel that you seem to spend a long time doing that with YouTube clips, etc.? That sounds really exciting, but why have you been nominated to do that and not the different people within the different providers?
So in Bradford, the local offer provide a newsletter, and I was already on my Send SharePoint putting a monthly clip up anyway, and a little bit of spiel, like so in the Send Champions, the school nurses have had a huge influx of referrals in relation to tics and girls with tics. You know, it's been nationally recognised. And they were like, what do we do? So we held a meeting with CAMS and the paediatrician to say, look, what's our pathway? And then we just put the information up there on the Send SharePoint to say, you know, with these referrals, this is, you know, and then because obviously it's relevant to, you know, that's our local pathway, isn't it? But it's obviously relevant to people reading the local offer. So that spiel, 2 paragraphs and a clip about Tourette's from the Tourette's action gets sent over to local offer, and they will use it on the local offer as well. And then, like I say, every month's different. So last month it was the fecal alcohol syndrome disorder. This month it'll be Down syndrome awareness, and they'll just put my little spiel. But I was already, I think what it was I was already doing it, and then it was just a matter of somebody reaching out and saying that they're doing something similar, and so that's why it was shared. But I do umbrella coordinate the local offer for the whole trust, so I'll do the Send one, the CAMS one, and check. It's for me, it's part of my role to check the information is up to date, like if a telephone number changes or something.
Thank you. Thanks.
I can see Claire Martin in Blackpool, who's also got their inspection this week.
I have. Do you know, this is the first opportunity I've had to not talk about Ofsted, and I've really enjoyed this afternoon just to get away from that. All my interviews have happened, so yeah, I just had a little opportunity just to chill with a couple of
done, Claire.
this afternoon.
I've got it next week. So.
We are mid-inspection at the moment, but it's really interesting. Thank you for your presentation. It's not really a question, it's just an observation, really. So I'm a DCO in Blackpool, but I am employed by a provider, not a CCG, and I am a health visitor and have been a team leader in health visiting for, so it's a very similar background to yourself.
Right.
And I'm really interested in your role because I cover lots of providers. So although I'm employed by one provider, they just host my post, but I straddle lots. And
I'm children's services, but I tend to to do the whole trust because there's nobody else. Yeah.
I work across quite a few trusts though, so
Right.
and don't have the opportunity to do some of the things that you're doing around sort of the SharePoint, which I think is a really good idea for everybody. And I do think that this is a missing golden link really for other trusts in having that named nurse. So we have SEND champions, but they are very senior leaders for organisations that come to meetings, and we chair that meeting as DCOs, but we don't have operational SEND champions within our provider organisations. And I do think that the work you're doing is a missing link really in terms of operationalising some of the strategic stuff that we need.
I do think what our SEND champions that are representatives from a service, they're the ones communicating with the children and young people, and that voice can get lost as it goes higher up. So sometimes I'm in meetings and I'm thinking, but that's not what we're hearing on the ground. So yeah, it is about, I think the education healthcare plan is the voice of the child, isn't it? So therefore we need to be working directly with either the child or at least the people that are directly working with them.
Yeah, so I just wanted to say I'd be interested to see how your role evolves really in the future, and I think you sounds like you're doing a great job.
Well, it's becoming a team, so I'm hopefully getting 2 staff, so it's busy, and it'll be more interesting it'll be more exploration of analysing where the gaps are for our area. Thank you. Thanks, Claire. Louise.
Hi, I'll put my camera on, although I'm not really dressed for the occasion. I work for Blackburn with Darwin as an SEN officer, and prior to joining Blackburn in August last year, I was an SEN officer equivalent at Lancashire County Council for 6 years. So I've been drafting and writing education, health and care plans, attending reviews for quite a substantial amount of time. And what I'm finding is that sometimes the advices from health professionals, which are brilliant, we do get them, which is brilliant, but sometimes they're overstepping the boundary in terms of area of expertise. And I'm just wondering if health professionals have had that feedback from perhaps education professionals. The example I'm going to give is where a health professional advised that a child needed a smaller school environment, which is fine because the child has physical disabilities. We can understand that, but then advising on this child needs a smaller class size. Now, that's not a decision of a health professional. Like, I couldn't say how many exercises you need to do once you've broken your leg and you want to fix it. So I'm just wondering if there's that kind of training for health professionals, because I think quite often health professionals, they've worked with families and parents for quite some time, and they don't realise that perhaps they're putting themselves potentially in trouble by listening to what parents want. Does that make sense?
Yeah, so although I haven't got a quality assurance tool that it's all in the process of being looked at, our quality assurance starts with, say, a health visitor, school nurse, speech and language therapist, staff from CAMS will write their report, and then at least a band 7 checks it just for that reason, so that nobody goes, oh yeah, they need a specific piece of technology. So that wouldn't go out without that check, and then it gets checked again on the CCG side before getting out to the so we've got a number of checks there.
Lovely.
So we wouldn't, and in the training, it's very clear in our standard. I wrote this earlier this year, a standard operating procedure. It's very clear about writing recommendations, and it's within the standard operating procedure. I'd say one of our bigger problems is consent. We don't always have a copy of the consent, and that is probably one of our bigger concerns, is that I don't want information to go out without consent, and really, having some constructive conversations with the child and family before it goes out. But yeah, I haven't had feedback about that, but then I think the training does really our own local training really does highlight that, and the band 7s know to look for that before checking it and passing it on.
That's great. I see Vicky's put a comment on, and more specifically, when I worked for Lancashire, the DCOs were really working very closely with the paediatricians in regards to, you cannot recommend that that's what they need, because the schools were saying we haven't got the evidence as yet.
Yeah, and I think also we're quite lucky. We have really good health and partnership network meetings. So they happen every month, and really good attendance as well. So I think when we're talking to the local authority in these meetings, you know, all these things, they've been going on, you know, for a good, you know, for a long time now. So all these meetings iron these things out. So if these things were coming through, they probably have been ironed out by now.
Oh, that's brilliant. Yeah, lovely. Thank
We're
you.
having very similar problems to Louise, though, in the area that I work in as DCO. It's not the therapists, it's not the nurses, it's not the OTs or the speech therapists, it's the paediatricians and the psychiatrists that are a law above them, everybody else, and are writing letters when families go in crying on their appointment slots, to whom it may concern, education, totally let this child down. He's got very special needs. He needs to be in an independent special school, without describing any of what the health needs are. And it got to the point last week where our local authorities were threatening to contact their own solicitors to issue a cease and desist letter to the paediatricians, because they are not learning. Since Christmas, I've gone back to the paediatricians on 4 separate occasions about 4 separate letters. They tell me they've got a quality assurance process in place, such as you've described, Joanne, but paediatricians don't always put their letters through that QA process. They just get their secretaries to type up the letter and send it in. So it's
I think
my head along with you, Louise. It's paediatricians in my experience.
Yeah, I did find that specifically in Lancashire, but I've got to say that the DCOs in Lancashire have worked really, really closely with the paediatricians, and anytime we came across anything, we would highlight it to our manager, who'd liaise with the DCO, would then follow it up, and it was getting better. But this was a recent one. I work with Blackburn with Darwin at the moment, but it wasn't a Blackburn with Darwin health professional because of a boundary. So, and it was actually a physiotherapist, and a lot of works had to be done, and unfortunately this physiotherapist is off work now. I don't know if it's related, but it could be, and that's what we don't want, because parents can be quite persuasive when you've got those relationships. So that's been looked at to an aside, but it's happens, sounding like it's happening right across the country. It's not just in a silo. So that's great. Thank you for your feedback.
That's something that Lorraine Mulroney has been made aware of on numerous occasions, so that she can try and get it out at the really senior level, so it comes back down through their government, their I don't know, HCRP or whatever it's called, the Royal Society of Paediatricians, because certainly then the Association of Paediatrician Physiotherapists, OTs and speech languages have their own guidance for their own members, so it's really clear for them what they should and shouldn't be writing. But paediatricians, maybe they're too busy to read it. Sorry for any paediatricians on the call.
I'm just conscious that my time's running out and there's still 2 hands up. So there's Terry.
Thanks, Joanna. I was just wondering how you're managing to engage your adult services, where you are, both you are.
Not really. In the senior executive team, that started a few months ago. Bear in mind, I only started in May. In the senior executive team, it's been interesting who attended for the first meeting. We had really poor attendance, and then it's got better with the last 2 meetings. The last meeting, it really has improved. One of my little campaigns is going to be having a change in place within the locality, within, you know, linked with the trust, and I really wanted the estates involved, and I really want adults involved. We are getting better. One of the challenges has been even having CAMs involved. They haven't necessarily had a good understanding of SEND and why it matters to the child's mental health service. So I'm just breaking down little barriers by little. Really lucky at Bradford because we've got a transition team a transition learning disability transition team, and they have started. They've always come to the SEND Champions meeting, but yeah, break into the adult service. Work hand in hand with the transition team. So I'm kind of lucky there, but yeah, actual adult district nursing and things has just come up by case situation. That answers that. But having the executive support team, I think we will build on that in the future.
All right. If there are any questions, maybe they can email you, Joanna,
Yeah,
if you want to your email address.
My email in, because I've forgotten to do that on the slide.
Yeah. So this is the end of the first workshop sessions. The next one is in 7 minutes or so. So you do have a comfort break for a bit. But yeah, thank you all for coming to this one, and hope to see you in the next one.
Thank you loads.
Thank you, Joanna.
Thank you. Bye-bye.